Morning, everyone. So my name is Shazia Khan, and if you have any questions, just ask in the session whilst we go along. The unit that we'll be doing, it's the first session today, which is Learning Outcome 1, and the unit we'll be doing is Unit 4, which is Personal and Professional Development in Health and Social Care. So I'm going to go through the unit specification with you, then we'll go on to the slides. Is everyone okay with that? Yeah. Okay, so the unit aims to develop the knowledge and understanding of personal and professional development. Learners will develop techniques for planning, implementing, and evaluating your own personal and professional development, and an understanding of how to support others in personal and professional development. Now, when we talk about personal and professional development, what's the first thing that comes to mind? What do you think it is? What's personal development?
I think is the means of improving one's knowledge about a
Yeah.
particular something.
So what's the difference between personal and professional development then?
I think personal one is the one you decide to do by yourself on your own,
Yeah,
while the
yeah.
professional one is that of the profession one, which one is involved in how you develop yourself therein.
Yeah, so the personal one. Suleiman, do you have any definitions or any examples of personal or professional development?
No.
What do you think it is? No? So personal development is making changes to yourself, trying to learn new things, trying to learn new skills in different aspects of your life. It's about your own strengths, like Amid Bola said, yourself, your strengths, your weaknesses, how you improve your self-esteem. Whereas in professional development, which we're going to look a lot in about this in learning outcome 2 and 3, but professional development relates to your career, how you want to advance your career, how you want to better yourself, and how you want to achieve your long-term goals. Could it mean the fact that you might want to, in your professional life, you might want to apply for a job with in regards to a promotion in a job, maybe? Could it mean that? Could it mean your CPD skills? So these kind of things would apply to professional development. So the unit we're looking at, like I said, is personal and professional development. It's a level 4 unit. So are you both on the right unit? Yeah. The credit value is 15 and the unit grading is pass, merit and distinction. So in order to achieve the unit, you must produce work with demonstrated achievements of the learning outcomes and standards. So to achieve your merit or distinction, you must demonstrate that you are meeting the criteria, the assessment criteria, which we'll be having a look at the bottom here. So the first assessment criteria, quickly to go through, is to understand career pathways in health and social care. And we'll look at the different career pathways, what the expectations are, what qualifications you need, and what skills. Then the second, to gain a pass in that, you need to complete learning assessment criteria 1.1, which is to analyze different career pathways in health and social care. 1.2, which is to research one area of potential opportunity for personal career. To gain a merit under learning outcome 1, you need to look at 1M1, which is to assess your own skills and experiences against identified potential career choices. And then to get a distinction, you need to do 1D1 as well as all them, which is to evaluate your own personal development today against requirements for chosen career opportunity. Do you understand that?
Yeah.
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 So
Yeah.
now going on to learning outcome 2, which is we'll be doing tomorrow, is you need to look at understanding the importance of personal and professional development and the processes, principles, and techniques around that. The assessment criteria is 2.1, which is to explain the indicative content and look at the importance of personal and professional development. and 2.2, which is to explore the principles, processes, and techniques for personal and professional development. And you'll be looking at learning outcome 1, learning outcome 2, and learning outcome 3. And 3 and 1, you need to adjust the plan in response to the feedback. In learning outcome 3, you need to present a personal and professional development plan. And the assessment criteria for that is 3.1, which is to prepare a personal and professional development plan for progressing in career in health or social care. And 3.2, to obtain feedback on personal and professional development plan. And then 4, learning outcome 4 is to understand how to contribute to personal and professional development of others. And you look at 4.1, which is to look at analysing the characteristics of effective learning culture, and 4.2, which is to analyse the role of managers in the personal and professional development of others. And that's the pass criteria. The distinction criteria for this is 4D1, which is assess how managers and team leaders can develop an effective learning culture. And the indicative content is just listed there, which we'll be looking at more in detail in each learning outcome, okay? And then after this, you will have so you'll have the 4 learning outcomes, and then you will have the assignment discussion, okay? So we'll go on to the first learning outcome. Is everyone okay with that? This is all available on Moodle for you. So you need to go onto Moodle and look at all the additional resources and the unit specification and the learning outcomes, and the recorded sessions will be on there for you. Has anyone got any questions before we move on to the slides?
No.
No? Suleiman, have you got any questions?
No.
Okay, thank you. So we're just going to go on to the slides. So the first session we've got is learning outcome 1, okay? And I'll ask you brief questions as we're going through as well. So learning outcome 1 is obviously about understanding career pathways in health and social care. So what kind of pathways do we have? What kind of careers do we have in health and social care? What do you think? What kind of careers do we have?
Person-centered care.
Yeah, person-centered care. But what kind of jobs do we have, in the health and social care profession?
The healthcare assistant.
Yeah, healthcare system. What else? Anyone else? We have a lot of different jobs, either direct care or, maybe a manager, office manager, it could be a nurse, it could be a mental health officer, so there's loads that we could go through, and there's loads of jobs available in the health and social care profession. And it's really important, within the health and social care profession to have these jobs in place. So the aim, as we mentioned earlier, is to develop your knowledge, understanding of personal and professional development. Learners will develop techniques for planning, implementing and evaluating their own personal and professional development, and an understanding of how to support others in personal and professional development. The indicative content for learning outcome 1 is to look at a range of pathways and roles in health and social care. Requirements, for example, qualifications, experience, characteristics, ethics, routes to identified roles, apprenticeships, qualifications, university degrees, potential employees in the field where they wish to work, skills, responsibilities, expectation, identifying your own interests, skills and attributes. So looking at a skills audit, and the sources of careers information. So, there are different elements of careers information. There are different routes to take. Now there are different routes. Every year there's something new being developed. And the whole point of there's more apprenticeship routes, because they want to do learning on the job, so that the person can, develop their skills. So the key terminology: careers within the health and social care. So social care is providing physical, emotional, and support to help people in their life. You know, there's loads of different skills, and there are different career paths, as I mentioned, you know, within the health and social care profession, you know, and they aim to promote any sort of evidence, guideline-based care, and improve the organisation efficiency of care and reduce costs. So, you know, it's really, really important that we have the different range of jobs as we have in the health of social care, both for adults and for older, you know, people in place, you know, people that have dementia, the young people. So it's a need for it. So the next slide is a video, and it looks at different types of healthcare jobs in the UK. And you can have a look at that in your own time, okay? So it just helps you identify any sort of job roles that, you know, we have within the UK healthcare system. So we've got 1.1, analyze different career pathways in health and social care, okay? We have care assistants, support workers. What do you think care assistants do? What do you think care assistants do?
To support vulnerable people with their personal care.
Yeah. So are they very similar to a nurse's job?
Sure.
Is it similar?
That's not for the same.
No. So as a care, is a nurse more qualified than a carer?
Yeah.
Yes. Yeah. So they have more qualifications than a carer, whereas it could be, you know, it could be a personal assistant, you know, caring for you. It could be a support worker who provides any sort of direct care, such as, you know, personal care. You know, if anyone's got any learning disabilities, or, you know, anyone's old, they have, you know, maybe need support at home. This personal support worker and care assistant will be the one that will provide any sort of personal care for that person at home. Nursing assistant is someone who assists the nurses, so they're not fully qualified at the moment. They may be doing the the degree, but they're not fully qualified. And then we've got the registered nurse, and that person is a qualified person who's there, who, when we look at it later on, is who's done her degree and who's there to implement any sort of provide any sort of patient care, any look at the health conditions, but also provides advice and emotional support for, you know, patients and their family. You know, they need that support from a registered nurse. So, you know, they care for, it could be adults, it could be, you know, elderly who are injured. And they also work with people with learning disabilities. And, you know, you can have a psychiatric nurse as well, which we'll look at a little bit at later, okay? Any questions? So these are the direct care roles. Then we have the special healthcare roles, paramedics. What do paramedics do? What are paramedics? Anyone? They are a healthcare professional who's trained in the medical field, and their often role is to provide emergency calls for any sort of medical care, transportation, and they work with the emergency medical services. Occupational therapist is the one who helps people with any sort of physical developmental, you know, any sort of anyone who has any sort of physical or mental health social circumstances, you know, sometimes make it difficult. Occupational therapist is there to help people with difficulties and evaluate and treat people who have injuries, illnesses, or any sort of disabilities. Their main goal is to improve and develop and recover that person and make sure that they, you know, have a good daily life. Then we've got a physiotherapist. What's a physiotherapist? What do they do? Amimbola, what do you think a physiotherapist does?
As it is written there, I think for people that have accidents and they have problem in movement.
Yes.
So
Yeah.
they help them in
And it could be any part of their body that they've injured.
Yeah.
You know, it could be their neck, it could be their leg, it could be any part. A physiotherapist is there to, someone that's, affected by any sort of injury to help with any reduce any sort of risk of injury, and try to get the person to come get treated and go back to their daily life and improve their daily life in a way. So there's a need for them as well. Then we've got mental health and social support roles. Do you think this is a big concern? Do you think this is a need for this? Do you think there's need for psychiatric nurses? Do you think mental health is an area that's increasing?
Yeah, there's a need of it, yeah.
Yeah. I think there's a need to have mental health workers, be it psychiatric nurses who care for the individual with any sort of mental health issues. And then you have social workers who are there to look at the care of the individual as well, whether there's a need for providing any sort of support for that person and any sort of counselling, advocacy needs, for that person and the family. Their role is to meet families and review the needs and support plans to put in place, and help also, develop and maintain living skills as well. Social workers, they keep the clients safe and take action to protect them when necessary. Things like safeguarding issues. If a child comes to the hospital and they've been hurt, they need to be, they refer them to the social workers if they feel like something's happened to that child, or where they've been neglected or they've been abused, and that would be reported. You have the counsellor and psychotherapist. They offer therapy sessions, and they are there to look at any sort of emotional and psychological difficulty for the individual. So, there is a need for them as well. We have healthcare management and administrative roles. So, there's besides all the healthcare side of it, there's a need to have managers on place, isn't there? Why is it they need to have managers in place? Why do you think it's so important to have managers in place?
Yeah, I think it will be the one to direct the affairs of the care home.
To look at, oversee the day-to-day operation of it. What happens, they're responsible for, looking at the day-to-day, making sure everything is dealt with, and everything is, they're following the policies and everything is compliant with the laws and regulations in place. Then we have a health information manager who manages and organizes medical data, ensuring quality, accuracy, accessibility, and security. Data protection, they need to make sure that they're looking at data protection, taking that into account, because that's so important in regards to any sort of, roles. Educational and training roles. Now, you have the educator who provides information to educate and promote healthy lifestyle and prevent any sort of illness or injury. There's a need to have a health educator there to try and train people, educate people. They collect data and analyze any sort of issues around there. They research things. They are, helping people access any sort of information about health conditions. They work with people to manage any sort of existing conditions like diabetes or Alzheimer's, so they get information for them. Training coordinator we have, who develops any sort of training programs for healthcare staff to enhance their skills and knowledge. Why do you think training and CPD is so important in healthcare profession, in any profession? Why do you think it's so important? Why do you think having training on safeguarding, on health and safety, or manual handling? Why do you think it's so important? Abimbola, why do you think it's so important to have training?
I think it's important so as to know the exact thing to do with each client at home. I mean, in the care home, for one to know what each client needs in the home, to know the way to
Yeah.
help them out.
Yeah, and if it's like also, if you're using things in a nursing home like a hoist or something, and you need training on that, don't you? You need to know how to use it,
Yeah.
because
Yeah.
you could use
Yeah.
it wrong,
We-
and the person could, you could affect the person's health.
Yes. Yes.
So you need that training. Training is so important. What do
Yeah.
you think, Solomon? What do you think about having training?
Yeah, because it is important to have training because let's say like the hoist that you used to make an example right now, if you didn't know how to use any equipment, you're going to
Yeah.
harm the person that you're going to take care of.
Yeah.
Yeah.
It's difficult, if you don't get the training, you may do something wrong, and it's not your fault. It's just because you haven't had the training.
Yeah.
So then you've got research and development roles, and this first one is clinical research associate, and this is responsible for setting up any sort of and coordinating any trials and supervising any sort of clinical trials that they have. They plan, prepare, and help out clinical trials to test on new medicines or any sort of investigation, and they need to comply with any sort of laws that are in place. Then you have a medical scientist who conducts research on to improve healthcare delivery and any sort of new treatments. And these careers involve focusing on qualifications. You need qualifications for these. You need experience, and you need the skill to do these. And these kind of roles are the fact that you may have to have done a degree, or you may have to be have done an apprenticeship or something. So you need to have the skills for that. Now we're going to go on to looking at 1.2, which is to research one area of potential opportunity for personal care. And, you've got health informatics is the interdisciplinary field that deals with the acquisition of storage, retrieval, and the use of healthcare information to support any sort of clinical decision making, patient care, and healthcare outcomes. It involves the information of technology and data analysis to healthcare. So how we deliver it, how we research it, why there's an importance to do that, and the research around it, why we need to do that. We've got potential opportunities. So you've got the first one, which is healthcare, health data analysis. And that one analyzes large data sets to identify trends, any sort of patterns, any sort of clinical trial, and looks at healthcare policy decisions. Then we have the health information manager, and they oversee and organize everything and manage all the data, patient care, healthcare records, information systems. Why is it so important to manage all the data? Why do you think data security is so important? Remember, do we have to take into confidentiality when we, look at a patient's data? Why is confidentiality so important?
You mustn't let the left hand know what the right hand's doing.
Sorry, what was that? So it's really important to have confidentiality to, make sure you keep all the data safe from for the patient, make sure you don't share any data with anyone that you shouldn't be sharing it with. Then you've got clinical informatics specialist, and they are this staff capture, communicate, and they use data and clinical knowledge to support health professionals. They develop and implement a range of digital tools to support this. So, this could be things like analyzing information about any sort of falls on wards, or to prevent hospital patients having accidents, maybe helping to develop electronic records, or running a system which stores things like x-rays or ultrasounds. So they're usually qualified health professionals, are clinical informatics specialists, such as doctors, nurses, or allied health professionals. So, they've got quite an important role in that. So the next one is healthcare IT project manager. Why do you think IT is so important within the healthcare profession? Why do you think there's a need for IT?
I think because
Yeah.
of this where we for keeping information about
Yes.
the
Yeah.
care home, so we need IT knowledge,
Yeah.
because
And
without the
also
IT knowledge,
yeah.
keeping the information in the iPad, login, everything will
Yes.
be a bit difficult.
Yes. So it's literally, you know, trying to plan any sort of upgrading of new systems. So maybe Windows 10 has come into place. You need to upgrade all the healthcare IT system. Then we have a telehealth coordinator who facilitates the adoption and utilization of telehealth technologies. And they are there to, you know, provide support and guidance to those using remote healthcare services, especially in regards to use of digital technology and telehealth services. Then we have the healthcare informatics educator, educating professionals on the new technologies, providing any trainings, any sort of workflow, you know, and productivity. So there's a need for IT jobs as well within the healthcare profession. So qualification and skills. So, you know, a degree in healthcare professional, you know, a degree maybe in IT, you know, proficiency in database, knowledge of laws in place. You know, you need to know, you know, that there are careers, you know, there are knowledge, you have laws in place, you know, you need to be experienced, you know, you need to have a degree for some of the jobs as well. You know, you need to have the qualifications, the right qualifications. So when you're going for a job, you need to know what the qualifications are. You know, there's a different level of qualification for different jobs. You know, in social healthcare, for nursing, you have to do a degree. For medicine, you have to do a degree plus, you know, your training and things. So, you know, there are skills and qualifications required for jobs within the healthcare profession. So potential employers, hospitals and healthcare systems. It could be health insurance companies, government agencies, healthcare consulting firms, healthcare technology vendors. It could be, you know, care homes as well. A lot of people work in care homes to try and support people there as a carer or a support worker. Career advancement, and that is really important, you know, trying to further your career. Why do you think it's so important to have career advancement? To improve your career, to maybe, you know, improve your role. Why do you think career progression is so important?
Yeah, I think it is more important because it is going to make you more professional
Yes, yes.
in your work role. Yeah.
Yeah. So, you know, no matter what you do from any job, you are in your career path, there's always opportunities for you to develop and progress in social care. You know, there's different jobs, different roles. You can do the training, the qualification, and you might get there. So as a healthcare assistant, you might be still doing your degree, you know, to qualify as a nurse. You know, it makes you work in different settings, but different, you know, move up with more responsibility. And you need the right qualification, you know, so you need to have your training. And if you need a degree, you need to have that in place. If you need to do an apprenticeship, you know, they'll do that, but they'll do additional places where they'll send you to college and things like that. And, you know, career advancement, you know, networking is really important in certain conferences. If you go to, you know, any training courses, networking is really important. And also, like we said, pursuing a career, doing training, mandatory training, but, you know, doing a degree if you have to get a qualification. So in summary, we've looked at exploring healthcare informatics and also looked at improving the healthcare delivery, your qualifications, your career advancement. Now we're going to move on to 1M1. So 1M1, and this is the merit one, is to assess your own skills and experience against identified potential career choices. So here you assess your own skills against identified career professions in health, informatics, and you can follow these steps. So self-assessment. Firstly, why self-assessment so important? Why do you think self-assessment is so important? What do you think self-assessment is?
Self-assessment is more important because, yeah, it is going to let you know more of your skills.
Yeah.
Yeah.
So self-assessment is about assessing yourself, okay? Reflecting on your skills and your interests and how you identify. So you'd use the SWOT analysis, strengths, weaknesses, opportunities and threats, and look at your educational background, how you can self-respect and how you can improve. And it's so important to self-respect, self-assess on yourself as well, because it's a starting point for you to get an action plan together. So firstly, you reflect on your skills, experience and interests. Consider what aspects of health informatics appeal to you the most. Secondly, identify, like I said, your strengths, weaknesses, any sort of areas of improvement, technical skills, communication skills. Number three, review your educational background. Maybe you want to do a course, maybe you want to do a certificate. You should look at your self-assessment and reflect on yourself. Research career requirements. So research the specific skills, qualification, experiences required in health informatics. Look at your job descriptors for positions. Identify common qualifications and certifications, such as, if you want to do a degree or if you want to do like a certificate in something, you need to be identifying that. Compare skills and your requirements. So compare your own skills and experience with requirements for health informatic roles. You need to look at your own skills. Why is it so important to reflect on your own skills? Some people don't like reflecting on that, but it's really important. Why do you think it's really important to reflect on your own skills? Abimbola, why do you think it's so important if you wanted to progress in a job? Why do you think you need to reflect on your own skills?
Yeah, you want me to reflect on
Yeah.
your skills so as to know the next step to take, so as to know to improve your skills,
Yes. Yeah.
so as to learn more about what you are doing, so that I will not just be
Yeah. Where you
on a
need to
spot.
gain
Yeah, you need
additional
to gain more.
experience.
Yeah, to gain more experience, additional experience to
Yeah.
what you have known before.
You may need training in, safeguarding. You may need training in health and safety. You may need training in manual handling. You may need training in, areas on maybe if there's loads of patients in the care home on Alzheimer's, they may need to train you on diabetes, any sort of medication, things like that. So training is really, really important. Identifying skills gaps. So, you would, when you look at your own skills, you would identify your skills gap, where there's gaps in your skills. It could be that you may need to go to more training classes, it may need that you need to be able to, develop your skills and focus on your goals and achieve your goals, but you need to identify what your skill needs and gaps are. It might be something really, small that you need to look at, but it would be a skill gap for you. So create a personal development plan. So based on your self-assessment, you need to create a personal development plan. You'd look at a personal development plan is a structured framework for you to use, and it's become aware of your skills. It identifies your and develops your skills and works out what you want to do and how to achieve that. And you would use for the personal development plan, because it focuses on your into your goals and achievable goals, you'd look at the acronym of SMART, which is specific, measurable, achievable, relevant, and time bound. And these would be goals for you. When could you do it? How you would do it? Why you need to do it? And identify the specific one, how it's measured, if it's achievable or not, whether it's relevant to your job. And obviously you look at the time bound as well, how long it's going to take you to do that. And this is a really good way of trying to achieve your skills. The SMART acronym, it does help you try to look at your specific, measurable, achievable, and time bound. So it is a good skill to have in place. Regular review and update your personal development plan. Why is it important to update your personal development plan all the time? Can it change? Your goals, can they change your skills? Yes, they can. They can change.
Okay.
So, to review them all the time is really good. One of your within the SMART goals maybe to become the head of, the nursing home. And for that, you would require, skills, and you would require additional training. And then you'd look at how long it take you to acquire these skills, and if you need further training and what the time frame is. So you're looking at the SMART acronym there. So in conclusion, accessing skills against identified potential career choices in health, you can better understand the readiness and be more proactive to enhance your skills and your qualifications. So it's really important to make sure you do that. The next one to look at is 1D1, which is the distinction element, and that's to evaluate your own personal development today against requirements for chosen career opportunities. So to evaluate your own personal development today against your requirements, so you would review career requirements. You start by revisiting the job description and requirements for the specific role you're interested in the field. So pay close to, you need to, when you look at a job description or a job application, you need to look at the qualifications. You need to look at the skills, because there's no point applying for a job if it doesn't, it doesn't apply to you. You need to make sure you are looking at that. Assess your skills and experience. So reflect on your own skills, experiences through your education, through your work. It could be any sort of training you've done, any sort of, careers you've attended, any sort of extracurricular activity. Identify your skills and how they align with the job requirements. And then identify your skill gaps as well. That's a really important element. Identify, which we talked a little bit about earlier, where you identify your current skills and experience and requirements for the chosen career opportunity, technical skills, your knowledge of specific software or tools. And, you have to be honest with yourself where you may need further development. You need to be honest with yourself. You need to self-assess yourself and reflect on yourself, because it's so important. People don't like to be honest with themselves and say we need training here and there, but it is really important. Evaluate professional development activities. So you assess the professional development activities you've undertaken to date, such as coursework, training programs, any certifications, workshops. Consider how these activities have contributed to your knowledge, your skills and competencies, and also reflect on achievement and challenges. So reflect on achievements and successes in your personal and professional development journey thus far, and also acknowledge any challenges or obstacles you face along the way and reflect on how you've overcome them or what you've learned from them. Create an action plan. Now, creating an action plan is really important, because on here you're looking at your self-assessment, you're looking at your specific action plans, you're looking at the SMART acronym, you set realistic and achievable goals for further professional development, such as new skills, gaining additional experience, or any sort of networking you can do, and develop a timeline. It's really, really important you develop a timeline. You identify how long something's going to take you, because your degree could be 3 years, but a training course on Alzheimer's could be a day's course. So you need to make sure you are achieving your goals by doing an action plan and making sure that you are assessing how long it'll take you, whether it's achievable as well, and consider any sort of support or guidance from any sort of careers or any other industry. And it's really important to self-assess as well. Continuously monitor and adjust. Have you got any questions on self-assessment or reflection, anyone?
No.
No? Suleiman, have you got any questions?
No.
So it's really important to continuously monitor and adjust Why is it important for you, Abimbola, to monitor and adjust your progress and your professional development?
I think it will help one to be more effective
Yeah.
in
Do you
whatever
think
you
it's
are doing.
important to have an action plan in place?
Yeah.
Why do you think it's so important to use an action plan?
I think it will broaden the knowledge that one have in that particular field. It broaden the knowledge, then it will make one to anticipate for more things. I mean, you will be working towards your plan.
Yeah.
Yeah.
Will you set yourself goals?
Yeah.
Yes. You will set your self goals. You'll identify your needs. You know, they're so important. Suleiman, why do you think it's so important to have continuous monitoring and adjustment as well? And have action plans in place?
Yeah, it is so important because I think it will make you more flexible in your work to one, and it will also make you more active in your work. Yeah.
So would you monitor your progress in the form of, you know, whether you need to have more training in a certain part?
Yeah.
You know, or whether you need to have any support. You know, you need to, as an individual, you need to be asking your manager all the time for extra, you know, extra support or extra training. You know, you need to be asking for that, because, you know, you need to make sure that you are aware that, you know, in your profession, you can, you know, go up in, you know, the profession. So it is really important to identify that, you know, put action plans together, self-assessment, you know, self-assess yourself, you know, planning is a really important part of action planning. What needs to be done, when it needs to be done, by whom it needs to be done, and what resources you need. That's, you know, the main stuff in regards to it, whether you can do it, whether, you know, it'll identify any sort of skill set for you. So continuously monitoring and adjusting is really important, but, you know, self-assess, it provides an opportunity for you to look at your strengths and needs, you know, and make sure that you are, you know, getting enough training, make sure you are getting enough CPD, and make sure you are, you know, developing your skills, not just professionally, but personally as well. You know, it looks at your needs as well, you know, because you need to identify what you need to improve and have continuous monitoring and adjusting. So in conclusion, by systematically evaluating your personal development today against the requirements for the chosen career opportunity in health informatics, you can identify areas of strengths, areas for improvement, and actionable steps for further development to enhance your readiness and competitiveness in the field. So it's really important that you're on top of everything. You're making sure that, you know, you're self-assessing yourself, self-evaluating yourself. You're making sure you're doing training courses. If you want to, you know, further your career and progress, you do the right qualifications. Maybe if you want to become a nurse, you have to do the degree. And any other healthcare profession you need to do, you know, you need to make sure you're doing some sort of certification, or if there's a qualification or skill you need to do, make sure you're doing it. You know, you have that choice as well. Has anyone got any questions in regards to learning outcome 1? As we've finished learning outcome 1, these are some of the references that we've used that you can refer to and use as sources for your assignment when it comes to it. So there's 2 pages of references for today's session. Things on continued professional development, personal development. And then if you refer to ebooks and any sort of journals on Moodle for this unit, and all the recordings will go on Moodle. I've put a link there for any sort of further reading that you want to do about working in the healthcare profession and what kind of jobs are there, and what qualifications you need, your skill set. So that's a really good link. Have a read around that. It's a link to healthcareers.nhs.uk. And if you have any queries or questions, you can email learnerwork@ukvarsity.co.uk, and submission of your assignment is 2 weeks after the full unit is over. So we've only done learning outcome one yet, so don't worry about the rest of it yet. Have you got any questions, Suleiman or Ambimbola?
No, I don't have any
No,
question at the
no.
moment.
Okay, thank you for attending today's session. And the next session we've got is tomorrow at 10 o'clock, which is learning outcome 2.
Okay, thank you.
Okay,
Okay.
thank
Thank
you.
you.
I will see you
Bye.
tomorrow.
Okay,
All right.
Thank you.
Thank you.
Have a good
bye.
day.
Thank
Bye.
you. Bye.
Bye.